The idea was to use as a standard bortezomib and dexamethasone, which is an established treatment for patients with relapsed myeloma, and to compare it with carfilzomib with dexamethasone. So it was a head-to-head comparison of two proteasome inhibitors. The patients included in the trial were patients with relapsing myeloma who have received 1 to 3 prior lines of therapy. And these patients could have received prior therapy with bortezomib, but they should have been responding to bortezomib and progressing at least 6 months of treatment with bortezomib. So a very large number of patients were included, 929 patients. The randomization was stratified according to prior lines of therapy, ISS, prior exposure to bortezomib, and the main findings of the study was a significant improvement in PFS, in progression-free survival, in favor of KD at 18 months versus 9 months with bortezomib. So there was a doubling of the progression-free survival. Furthermore, response rate was higher in favor of KD. Toxicity profile was acceptable with both arms. Peripheral neuropathy, constipation, and diarrhea were common with bortezomib, whereas shortness of breath, cough, pyrexia were more common with carfilzomib. Also, there were a higher grade of hypertension in the carfilzomib arm, and a small but definite increase in cardiotoxicity in patients treated with carfilzomib and dexamethasone. I think there are several implications. First of all, this trial will help and will expedite the approval of carfilzomib in Europe. As we know, this drug has been available in the United States for the last 3 years, but not yet in Europe. And also, carfilzomib and dexamethasone may provide a very effective treatment for patients who have been previously treated with lenalidomide, and we know that especially in the United States, many patients are on lenalidomide maintenance. Thus, we have another combination which appears to be very effective in the treatment of relapsing myeloma.